I'm Dr. Bartlett from Metabolab, your Biohack. We're a clinic that focuses on cellular health, body longevity optimization. Welcome to my home gym. A lot of times, one of the first things patients tell me about their doctors is that they don't know what their doctors actually do for themselves, for their health, how they invest in their health. Do they work out? Do they care about working out? Do they care about eating right? And sometimes after a patient of mine, a client of mine has seen me and then they go back and see their PCP, they feel as though their doctor doesn't hear them because they don't understand, honestly, how to move the needle from a optimization perspective, from exercise, nutrition, etc. So I think it's a useful thing if you actually see the doctor that you might be working with or you're currently working with working out. Because if I don't know what I'm talking about and if I can't feel it and explain it to you, then I know that your success rate is going to be lower. So Zone 2 cardio is really fascinating because it turns out that the elite athletes that are doing endurance training, they're training at Zone 2 cardio. So what does that mean? Zone 2 cardio is looking at, of your 1 through 5, usually 5, sometimes 6 depending, but 5 zones of what your cardiac heart rate, your pulse, your beats per minute, what that is. So it turns out that Zone 2 is excellent for keeping your body excellent at utilizing fat for fuel. Some people may be familiar with the term that when you're running or you're doing cardio, you're burning carbs. And for many people, that's true. But Zone 2 is a great way, and it's not easy, even though it's a somewhat lower heart rate. That's Phil, my cat. Even though it's somewhat a lower heart rate, does not mean it's easy. In fact, when I started training Zone 2, I actually found it harder than if I was just all out sprinting and trying to go towards, let's say, a certain number of meters, whether it's on the skier or my cycle or my rowing. Because there's an intentionality of keeping your heart rate. Once you get it there as fast as you can into Zone 2 and then maintaining it, it is tricky and it is a good training session. I understand if people have done Zone 2 and they've done it on a treadmill or an elliptical or outrunning training and they didn't enjoy it, because it probably, with running, it probably does feel like a little bit of a slog and you're really out there for a long time. So for those especially who are worried about their knees, knee injuries, maintaining their joints, if you're a little bit older and you want to save your knees for hikes rather than mileage on the pavement, I would really encourage people to look towards either doing a ski erg or a bike erg or a rowing erg instead. I'll tell you from personal experience, I'm a person that plays tennis. I'm pretty good at sprinting towards the ball for my age. I'm in my mid-40s. I think I surprise people sometimes in what I can get. And despite that, when I started doing Zone 2 cardio, I really felt the impact. I really felt how hard it is to do, how to get your body working in a different space. Sprinting, doing high intensity interval training, go even further, doing yoga or Pilates, it's just not the same. So when we're looking at cardiovascular benefit and we're looking at trying to change body composition and we're talking about cardio, Zone 2 cardio is the ticket. Some of you have seen me repost the researcher who is in Colorado, and his name is it's hard for me to remember and say, and I don't want to say it wrong, so I won't, but we can link it. He's fascinating. I've been following him for years in his research regarding Zone 2 and understanding lactate thresholds. Now, without getting too nerdy about this, ultimately, he's also the guy that's leading the physiology training, getting them elite cyclists of the United Arab Emirates trained for their events. So this is a man that travels globally, is literally working with elite athletes to know. And it's an easy thing to think, well, they're elite, of course, but also you have to remember that if you're not consistently giving your body a new level to go to, it stops. You get a level of homeostasis, okay, which just means balance. And the body balances out there. And so that's why Zone 2, as you're doing this, your body is going to be adapting. For those who have a great heart rate response, your heart rate's going to keep dropping and potentially in a positive way, meaning less beats per minute as you become better vagal tone of that big old nerve in our body. That's a good thing, but that also means that you have to continue to push the needle, because you may start to drop out of Zone 1 if you don't know what you're doing. You're just looking at those numbers compared to how you're training over time. This is where I think it's really important to have a training tool set so that you're not doing things blindly. I think that's one of the worst things that people can do. So people say, oh, I just go run. I can tell I'm in fat burn. I've got my cardio ritual. I don't want to change it. Just blind to understanding the data of what their body's doing also means you're blind to the potential optimization and the lack of results if you don't know what you're doing. I'm a huge fan of the concept to equipment. And for that reason, I recommend either if somebody needs to invest in a piece of equipment, get one of the pieces of equipment, get multiple if you're able to, or find a gym that has it because their app is phenomenal to utilize. And if you have something that you can sync your heart rate from, for example, my Garmin watch, my Garmin can sync into the app too, so I can watch in real time what my heart rate is doing and see it on a graph as I'm working out. So just like I say in the clinic, what we don't test, we don't know. Same thing when you're working out. If you're not actually paying attention to your thresholds and seeing how your body's responding to what you're doing, and you don't continue to push it, it will stop changing.